is the time to address two very important fractures, although very simple. I know most of you get it right. One is called as Colles and one is called as Smith. What is common between them? Both are fractures of the distal end of the radius. Yes. Both are away from the wrist joint. Yes. Both do not involve the wrist joint. Yes. So both are extra-articular. Yes. So both are fractures of the distal end of the radius. Both are away from the wrist joint. Both are extra-articular. Now I hope you already remember that whenever you talk about a fracture, it has two fragments. One is called proximal, one is called distal, and I've already told you that the displacement will be decided according to the moment and direction of what? Distal fragment. We've already spoken about it, right? That the displacement will be decided according to the movement and direction of the distal fragment. So if you see here, then this is the distal fragment which is going like this. Alright, so if you see here, then this is the distal fragment which is going like this. So what is the displacement here? It is the dorsal displacement or the posterior displacement. Are you able to understand? So this is the dorsal displacement, posterior displacement called Colles fracture, if it goes anteriorly or if it goes volarly. Alright, so this is the dorsal displacement, that is of the distal fragment. So we call it Colles fracture. If the same thing goes for a volar or a anterior displacement, we call it a Smith fracture. And the interesting part is that Smith fracture is also called as reverse Colles fracture. Now I want all of you to answer my one question, that what is the most common complication of Smith fracture? Can anybody tell me? What is the most common complication of Smith fracture? Yes, can anybody tell me? What is the most common complication of Smith fracture? Any answers? I'm sure most of you got it right. It is malunion, and that malunion will give rise to which kind of a deformity? Garden spade deformity. That gave rise to garden spade deformity. Now, can you all tell me that what is the most common complication of Colles fracture? Can you all tell me that which is the most common complication of Colles fracture? Can you all tell me? Most common complication of Colles fracture? Yes, it is not malunion. It is not malunion. It is finger stiffness. Some of you have mentioned, somebody has mentioned dinner fork and even made a fork. No, it is not dinner fork. It is not malunion. It is basically finger stiffness. Are we able to get this? So guys, Colles fracture, I mean, this is the only fracture where at one point of time they had put up a question that Kaun hai wo Colles? Who's that Colles behind the Colles fracture? And four options were given: John Colles, William Colles, Abraham Colles. Definitely Virat Kohli was not in one of the options, but the answer is although Abraham Colles.